Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Chelating agents. Chelating agents used in treatment of heavy metal poisoning. First, British anti-lebesite or dimercaprol. In British anti-lebesite or dimercaprol, it is used. It has deep iron. British anti-lebesite is most commonly used for arsenic and mercury poisoning. It can also be used for lead and copper poisoning. EDTA or calcium disodium barbonate. EDTA can be given as intravenous route and EDTA is drug of choice or of lead poisoning. It can also be used for arsenic and mercury poisoning. 3. Penicillamine. Penicillamine is used orally and this is best for copper poisoning. Penicillamine can also be used for mercury and lead poisoning. 4. DMSA. DMSA is succinimers, that is dimercaptosuccinic acid is DMSA. So DMSA is oral. If available, DMSA is best for lead or arsenic. Desferoxamine. Desferoxamine is given orally and it is the drug of choice for iron poisoning. Forced alkaline diuresis.
thank you and thank you for watching.